Hello friends, welcome to a new lecture today on nipple retraction. So this nipple retraction, it occurs in the puberty or later in life. So the cause of this nipple retraction is many, but if this nipple retraction occurs in puberty, then it is of unknown etiology. The nipple retraction, it can be bilateral, and there is difficulty in this poses difficulty in breastfeeding. What is retraction? Normally the nipple will be like this, but if the nipple which is there that has been not everted out but that is inverted, then it is called as nipple retraction. So if the retracted nipple, if it looks like a slit like, then the cause may be ductal ectasia. If there is circumferential retraction like this, if this has gone inside like this to start with, then that is underlying carcinoma. For the nipple retraction, we don't need to treat nipple retraction because it resolves spontaneously. So I think you guys have understood about nipple retraction. Thank you guys for watching my lecture.